Do you think it's important to do a comprehensive examination on all your new patients? Or do you examine a patient in a hygiene room after they come for their initial cleaning? Well, an interesting article published in 2006 by Dr. Curry et al. In the American Journal of Dentistry looked at 235 different dental practices. And they asked 4 questions. Was a periodontal probe in the examination kit? Was there a periodontal chart? Was a periodontal examination always performed? And was a radiographic examination always performed? What they found was quite surprising. Out of 235 dental practices, only 10% did a comprehensive examination, which included periodontal charting and a full mouth series of x-rays. So what does that mean? That we are woefully undiagnosing disease in our patients' mouths. Now, most patients don't go to a doctor, and half the population doesn't go to a dentist. So if we get to see a patient in our practice, that's an opportunity for us to be able to give the patient all the information they need, not only about their dental situation, but their oral health, their aesthetics, and their systemic health as well. Based upon the oral systemic link, we can also do a medical examination to discuss with them the importance of seeing a physician, getting their blood pressure checked, getting blood tests, and necessary screening examinations, colonoscopies, prostate exam, etc. Now, we're not physicians, but we have an opportunity to influence patient in the right direction. In most practices, patient will call up and say, hey, I just want to get in to see the hygienist. I haven't had my teeth cleaned in a while. And what happens? The patient comes in, and in that 1 hour, the hygienist has to take x-rays, probably not a full mouth series. Will probably be 4 bite wings and 2 periapicals for some reason. They have to clean their teeth. They have to do an oral examination. They have to go over oral hygiene instructions. They have to clean their instruments. They got to reschedule the patient. And they got to make a couple minutes for the doctor to come in to meet the patient, develop a relationship with them as they're laying back in the dental chair like this, walk up to them, and within 2 minutes say, hey, I see something that needs to be done. Let's schedule a crown. Well, that's not a comprehensive examination. That is basically treating a patient like there's a pothole. We got a hole in the road. Instead of fixing the road, let's just fill the pothole. And most of us become pothole fillers. We become procedurists. In most dental schools, they don't teach us comprehensive dental care. That happens to be the truth. It may be a hard truth for you to understand or to see, but I know this from my own experiences because I've taught in dental schools for over 40 years. Some schools will treat comprehensively, but most don't. How do they treat us in dental schools? Well, you need to do X number of crowns, this many periodontal surgeries, this many scalings, this many extractions, this many, bridges, this many partials, and this many dentures to graduate. They give you procedures to graduate. They don't say you have to be nice to this many patients. You have to get this many patients to be comprehensive treatment. You have to educate this many patients. You have to do this many comprehensive examinations. It doesn't happen. In our periodontal residency, when I went back in the 80s, we had to do that. And today, in most periodontal residencies, most periodontists are taught to do comprehensive examinations. But I'll tell you, the truth is today, once people are out in the street and in practice, people get away from treating comprehensively. Why? Well, a couple of times it's because they want to make money. It seems to be easier to do that. It seems to be more stressful to have to do a comprehensive examination. Doctors tell me that, well, don't you spend most of your day talking and not doing any work? Well, about half my day is talking. I will admit that. I'm not doing surgery all day long. I'm talking to patients. But that doesn't mean that I'm not successful. It just means that my patients are educated. So when I am working, I'm doing things that are comprehensive. And we get through more treatment that way. So what am I saying? I'm saying that I think we miss an opportunity to help our patients by not treating them comprehensively. I think we're doing them a disservice and we're doing ourselves a disservice. I also think, and I'm not saying this to motivate you, that you'll be more successful financially if you treat people comprehensively. Because you're not like a dog running around trying to taste his tail, trying like a guy with a finger in a dike. Let's stop this leak, let's stop this leak, let's stop this leak. Because most patients in the dental practice, they get worse over a period of time. Bob Barkley, and his initial book talked about patients getting worse over time, that we weren't preventatively oriented. In this book that I've recently read about Bob Barkley by Paul Henny called Co-Discovery, it's just published this year, he talks about the importance of doing a comprehensive examination. Now, when did Bob Barkley live? He lived in the 60s and 70s. He died at the age of 47 in a plane crash in the early 70s. So he was talking over 50 years ago about the importance of comprehensive treatment, of the importance of preventative treatment, and of the importance of educating your patient. Matter of fact, he would not treat a patient until they had excellent oral hygiene. He would charge them just to show them how to brush and floss. And he'd show them everything in his mouth. It was like a show and tell. He showed them everything so that they could understand it, so they'd be part of the examination process. He'd tell them what the diagnosis was. He'd explain why the diagnosis was that, and he'd give them treatment options. They didn't have to do ideal treatment, but they were given the opportunity to do ideal treatment. Most patients today are not given the opportunity to give themselves the best treatment because most dentists and doctors as well don't educate patients as to what all their options are. This is true in medicine as well as dentistry. When do people go see the cardiologist? After their first heart attack. After bypass surgery, they're told to what? Go to the gym, start to walk. Wouldn't it be better if we practice preventative dentistry? Wouldn't it be better if we practice preventative medicine? But I think, and this is just my personal opinion, I think that most problems in the world, almost every problem in the world, can be traced back to one thing. We're short-sighted. If you look at every problem that we have in the world, the wars that we have, we fight other countries. And then what happens? They become our best trading partners, 20, 30, 40 years later. We were enemies with Germany. Now they're our allies. We're enemies with Japan. Now they're our allies. What about global warming? Did we ever think that this was going to happen? We knew global warming was going on for a while, but when are we going to take care of it? Maybe when it's too late. It's preventable. It was preventable. What about the obesity epidemic in the United States? We have about 30% obesity epidemic in young people in the United States, which is leading to what? More heart disease, more diabetes, which leads to more heart disease, which leads to more periodontal disease. And we get into this vicious cycle about people getting sicker and sicker. Now, what's the problem? Besides people getting sick, they don't live as long. And when they do live toward the end of their life, they're sick. And guess what that is? Costs millions of dollars trying to keep people alive that are sick because they didn't practice preventative medicine. The same is true in dentistry. I'm a periodontist. I treat people who are losing their teeth. I treat people that have lost their teeth with dental implants and bone reconstruction. Almost, I would say probably almost 100% of the patients that I treat would not be in my office if they were given a preventative program when they're in their teens or their early 20s. But nobody was given a program back then. And if I see someone with early periodontal disease and I recommend scaling root planing, I say I want to put them through ideal care. They say, well, do I really need it? I go, well, you don't need it. Your teeth aren't going to fall out tomorrow. But if you do this now, in 20, 30 years, you'll have no problems. And when you're at a cocktail party with your friends and you're talking about seeing the periodontist and having all their teeth replaced, you say, I went through scaling root planing in my late 20s. And I've been going to get in the hygienist, get my teeth cleaned every 3 or 4 months or 5 months, whatever it is. And I have no periodontal disease. And I have no decay. And I wear a bite guard, so I don't wear my teeth. So these are some of the things you can talk about. You can be a true gift to your patients, to yourselves. Everybody wins with this. This is the total win-win situation. By treating people comprehensively, we all win. Now, Bob Barkley talked about this 50 years ago, and he was very frustrated. Why? Because nobody listened to him. They'd listen to him and they'd nod, as maybe some of you are listening and nodding now, but you're probably going to go back to your practices and treat the same way. This requires a commitment and requires some courage to get through that phase. So take the commitment, treat comprehensively. You'll have a better practice, you'll have happier patients, and you'll attract happier patients that want that type of care. And of course, you'll be the gift to your patients. Have a great day, everybody.